Well, folks, particularly those for the Crown agents at the back, please take your seats. Thank you very much for coming to a really interesting gathering. You have to accept the realities of these events is that there are going to be ministers coming, going, not quite getting here in time, trying to find the energy transition hub. So we'll just be as flexible as we can, invite them in when we can. There may well be cancellations. I'm sure people are getting messages already. But hopefully we can gather and really think through what is a critical issue. I'm James Cameron. I'm the chair of the board of the Crown Agents. Much thanks to DPWorld for giving us opportunity to have this event in their space, which is very lovely. It's also a bigger cooperation than that we're very grateful for. And you're going to get some great speakers up here in due course. And let me give some obvious context that health and climate intersect. They intersect in all sorts of ways, sometimes obvious in the sense that the physical consequences of climate change have health consequences. We can have discussions about the spread of infectious diseases or heat stress and strokes or air pollution in cities and asthma. In either or any of those cases, obviously, health and climate are connected. But they're also connected very much in the issue that we're going to deal with today. All healthcare facilities need power. What sort of power? Where the power comes from is a climate change issue. How our hospitals are powered. Maternity units, incubators need power critically. There are, we reckon, something like 60,000 facilities that have unreliable power. That's a life and death issue. You know, babies die when there is not constant and reliable power. And it happens fast. So you have to build rigorous, well-maintained systems for delivering power. And the essence of our conversation today is, let's make that power clean and green. Let's make sure the health care and the climate issue are bonded together in really practical, life-saving, but also in ways that are sustainable in every sense of the word. So we'd like you to think, whilst you're listening, about the difference between a good project that installs panels on a hospital roof and a sustainable solution that does lots of hospitals in an integrated way where life support machines are managed via the increasingly digitally hardwired systems for matching power and demand, and that the facilities that are being created are well looked after and maintained, and so that the rewards are not just for the installation, but the installation, the maintenance, the support systems, and increasingly the digital connections between supply, demand, and storage. So a great deal of what we are doing in the STEPS program that you'll hear more about is to ensure that we're building sustainable systems for installing, managing, and storing power so that the hospital administrator or the physician that's in the wards knows that it's reliable power and it's green. So that's the context. That's what we're really here to talk about. Now, we're also here to talk about specifically in the need to get resilient health in Africa. And we have, in the Crown Agents, a long-standing connection in the African continent. We have a presence in many different jurisdictions. We're working very closely with the government of Sierra Leone at the moment. No doubt you'll hear some more about that. And one of the tasks of an event like this, the big gathering, is to ensure that all these big promises that are being made on platforms are honored in the doing, that we have real flow of finance, technological resources, human capacity, so that problems are solved in the real world and announcements are made good by the doing of the work. And one of the things we pride ourselves in the Crown Agents is that we are a delivery arm of development. We are in country, we have local management and leadership. We know how to take knowledge of place and connect it to these big systems that you hear and present yourself at a COP like this. Okay, that's enough context. We have a little video we're going to show you. And I think if I step aside or beyond
Across Sub-Saharan Africa, 570 million people live without access to electricity. The electricity scarcity impacts the quality of services provided to citizens. In Sierra Leone, 89% of all health facilities lack electricity access. This can be a matter of life and death.
If a patient comes, you cannot do an ultrasound exam because of no electricity, or in the theater operating a patient at night and suddenly there is power outage, it leaves you a lot of difficulties actually trying to save the life of that patient.
When healthcare facilities have access to reliable electricity, critical medical appliances can be powered, equipment can be sterilized, clinics can preserve life-saving vaccines, and health workers can carry out essential surgeries. Despite an abundance of solar energy, Sierra Leone's public sector facilities are facing persistent challenges with electrification.
Powering that healthcare facility is one thing. Operationalizing that on a long-term basis to maintain some good sustainability is another thing. After the completion of the installation, because there is no operations and maintenance component, when things break down, there is no clear strategy in addressing the operations and maintenance.
So STEPS, which stands for the Sustainable Electrification of Public Services, is an innovative model that Bamboo Capital and Crown Agents have come together to develop.
STEPS is a service-based model that will shift incentives for energy service providers from completing installations to ensuring continuous availability of electricity over the long term. Our model unlocks new sources of funding, including private funding and social impact investors.
With electrification, something as simple as illumination at the health facilities, we will be saving more and more mothers and children from dying.
Very good. Panelists, why don't you come up to the podium now, come sit here, and we'll have to just adjust and adapt when ministers arrive or don't. So we were thinking that the problem might be the other way, and they would have too many people to fit on the platform. And so I've just put the names are up there. You've got bios. There are paper bios out there, so you can see what amazing people these are and what work they've done in the past. But it allows us to get on with a conversation with you that can be open, and we very much invite dialogue with the audience too. So when you have a question, please just think about asking. I know there'll be a Q&A session before, but if you really want to get something across, just catch my eye and I'll bring you in. So let's start with Joan then, and if the ministers arrive, we'll fit them in. There's clearly a huge challenge to get this money to flow to the right places in the right form, in the usable form. And we do have these big announcements here, and it's not clear often how you access the money, right? So that's a critical question to resolve. How do we build the kind of programs that can access these big commitments? You've got a very interesting program that you can talk about, HETA. That's an example. And I think it would give confidence to the room to show that you can build these coalitions and you can do deployment, which is the big thing, right? No more big promises without deployment, right? Joan, over to you.
Lovely. Good afternoon, everyone. My name is Joan Chahenza. I'm the Acting Project Director on HETA, a Power Africa program that's looking at electrifying healthcare facilities and providing these healthcare facilities with digital connectivity. HETA was actually launched during the last COP, and I'm very glad to say that we are in 11 countries right now and counting. And we've also been able to electrify 300 facilities and looking at ramping up that trajectory to include 1,200 more facilities in the coming months. Having said that, we are, as an alliance, the Health Electrification and Telecommunication Alliance, deploying this work through our partners. Apt Associates, the company that I work for, is the lead integrator. Then we've got Resolve, an NGO that's based in the US but has done electrified 24 facilities in Sierra Leone. We also have got Orange, the mobile network operator, for the telecommunication bit, and including also Bechtel.org, the social enterprise of Bechtel. So together as an alliance, we are, of course, tackling this hard problem, right? So far, 1 billion households are served by health facilities that have, number one, unreliable electricity. Number two are, actually have no electricity at all, where you cannot talk about, displacing diesel. I've been in countries where health workers have actually told me that, we have to go charge our phone in a far to reach area so that at night we're able to do, to perform births. Yeah. In this day and age, I think that is totally unacceptable. And we need to find methodologies of making sure that the financing is reaching these private health clinics and private health facilities at the grassroots. And also being able to do it in a sustainable manner. What we have seen in the past with donors, electrifying health facilities, putting up panels on roofs, and not necessarily having a clear long-term operations and maintenance is not sustainable. We need to find ways of structuring models that include, CAPEX and OPEX from the forefront. And there are several ways of doing it, and I'm really happy to be collaborating with Crown Agents in their work in Sierra Leone.
Gentlemen, you raised your hand there. What?
Would you mind to mention the countries? Would you mind to mention the countries that you are in already in Africa?
Okay.
Absolutely. I like the participatory bit of this. So we are progressed in several countries. So Eswatini, DRC, Tanzania, Nigeria, and Sierra Leone are the countries that are more progressed in terms of our intervention. How the intervention is structured is that half of the amount comes from Power Africa, half of the amount comes from USAID missions. So in-country missions have to buy into the project and contribute cash. And we are far advanced in those countries that I've mentioned. In the countries where we are still at planning stages, we've got Guinea, Kenya, Malawi, Uganda, and Zambia. So those are the 11 countries.
Where are you from, sir?
Tanzania.
Tanzania, okay.
Yes.
All right, thank you. Okay. Christian, let's turn to you now. You've brought a private capital mindset to a public goods problem. And the collaboration is wonderful to see. I understand your quite well from my own, but I think it'd be good if you could explain a bit more about how the collaboration works, what your particular contribution is, and in a sense give us some confidence that these partnerships can flourish using different types of capital to achieve a public good.
Thanks, and thanks for being invited here to participate in this panel. Maybe a quick background. So my name is Christian Schattmann. I work for Bamboo Capital Partners, and I'm responsible for everything that is energy access in our company. So with Bamboo, we have always looked at the private sector engagement, and we started with a pure investment approach. So investing in companies that provide critical services and goods to off-grid communities, solar distributors, mini-grids, C&I companies, raised capital from impact investors and other investors. But then we also started working on and managing sector development funds. So looking at how can we fix issues in the sector, remove barriers for development. And we designed grant programs and are running a couple of programs in countries like Haiti, Madagascar, Burundi, and now we're starting Niger and Mozambique. So really focusing on one particular country, looking at why do people not have access to electricity, and that increasingly involves public facilities, because now we all understand it's not only a household electricity problem, it's much bigger. Now, when we started this work 12, 13 years ago, we were already thinking about healthcare and public facilities. But it was a little bit too early, and we were focusing first on household. But for us, the ultimate impact that you can create is when you're able to provide sustainable, long-term electricity to those public facilities. So we were already starting to design a couple of ideas how to resolve that problem. And then we were put in contact with Crown Agents, and then we realized, okay, this is actually what was missing in our approach, the public sector side. Yeah. Because you cannot do that only from a private sector perspective. You need very strong government engagement, you need government commitment to make this work, and you need to work on a comprehensive model with a lot of different stakeholders. And ultimately, I believe that the solution is very simple, right? It's just we need to shift from short-term to a long-term focus. It's basically the same as in all these thematics at COP. The practical implementation is more complicated because it's not only dealing with kind of a way of doing and vested interests. You have to break that up, but it's also developing long-term partnerships who look beyond the typical 3, 4, 5 years horizon, but have a 10 years kind of a mindset. So what is important, where we try to bring in our expertise, is we need to make this work for the private sector in collaboration with the public sector. We need to make sure that the mechanisms that are developed actually work for companies. You have to do it in a way that private companies are interested in serving those healthcare clinics, that you de-risk them to a level that they can actually provide the type of service that we want them to provide. And then I think also, as a next step, we need to bring in private capital, because it is obviously a sector which still involves a lot of public funding, and that will, I think, continue for a couple of years. I mean, also public donor funding, but ultimately there is an opportunity to invest in this, because the solar capex is quite significant. The upfront investment cost. So you need to find someone who's actually financing that, so that companies can provide these long-term services. So our idea is actually to work together with Crown Agents, try to combine our expertise, bring in the public and the private sector, and design something that works for all different parties.
So Christian, let's add a couple more lines on that. The first is that you're clearly looking at a service model rather than in an installation model, and that's interesting. We should talk a bit more about that. And equally, you suggested that these combinations can reduce risk, distribute risk, and allow public and private capital to be combined. We perhaps want to delve into that a bit more. What other financial instruments might help this deployment go faster? So I've got some experience of the value of guarantees, sovereign guarantees. Really does help to make private capital move into delivering public goods. But I just think let's dwell a bit more, maybe both of you, on those things. Let's deal first of all with just making sure we've got this concept of the service being offered over time as opposed to the installation, and then what other ideas you might have about increasing the flow, so that we have a conversation, which I will come to you about, Joe, so that we're not just doing nice individual projects, but we're thinking about transformation across an economy at scale, right? That's really where the ambition should be, right? Rather than a couple of neatly tied up projects. So let's deal with both. Service first, and then other ideas about increasing the volume of the flow of capital.
Sure. So I guess when we talk service first, we talk long-term service, right? So there is that initial capex investment. You have to install the systems; they cost, and then you have a maintenance over a longer period of time, where you need to make sure that the systems actually operate to the specifications. and that anything that needs to be replaced, like batteries, etc., is replaced. And that's the one thing that doesn't work today. Today, everybody's focusing on installations, on putting the systems out there, and then there's no one really there who takes care of those systems. And as a matter of fact, these systems don't work after a certain period of time. And we have plenty of those hospitals in Sub-Saharan Africa, which have actually installed solar home system, but they have to run a small diesel genset, charge patients for running it, or they don't have any electricity at all because the solar system doesn't work. So really, shifting from an installation type of mindset to a long-term service mindset. So what does it mean if you have a long-term service contract? You need to find companies that are willing to supply not only the technology and install it, but actually maintain it and operate it for a certain period of time, for 10 years. Those companies, they are afraid of long-term risks. We all know, I mean, it's obvious. They will not want to engage with a government which ultimately owns those facilities in a 10 years contract if they have little confidence or trust in being paid over 10 years the amount of money that is contracted with them. So why would they invest upfront, take a huge risk, and not have income security, revenue security? So what does it mean? We have to remove that risk from those companies as much as we can. And there are different mechanisms. The first one is, as you say, there's a guarantee type of or insurance mechanism that could be developed. And we're working on that. We're closely working with MIGA. And the idea is really to get an insurance in the long term for the government payments. There is also the need to support certain governments in making that payment, because today we know that lots of governments are not able to pay for electricity. So we have a certain viability gap here that needs to be filled with a viability gap funding mechanism. And ultimately, if you really want to get private sector involved and incentivized in the long term, you have to make them pay electricity per capacity installed. You have to remove the demand side risk from them, because you cannot tell them, well, we pay you kilowatt hour provided, because they don't know how much will actually be used by the facility. So that the contract has to be a contract that says, well, you install a certain capacity, which, by the way, can be increased over time, but you install a certain capacity, and you're paid for that capacity be provided with a certain uptime, etc., to be defined. So you remove that demand side risk, and then the companies, if they have that long-term visibility of a revenue stream, if the demand side risk is removed from them, they can actually engage in a long-term contract. And then obviously comes in the private sector funding, because they still don't have the capital to deploy and to invest, because these are small operators, small energy service companies in countries where you need to support them with funding. So you have to have, and that's where we come in, some sort of a private sector fund, or some sort of a investment vehicle that invests in those companies, provides them with a capex loan so that they can get going. But the idea is also, those companies should not be making all their profit in the first year. They should be making profit over time, so that they're long-term incentivized. So they're a little bit, it's complicated in the small tweaks, but
the principle is the same. You've got to overcome the high capital cost. You know you're going to get low operating cost, but you want length of the contract, and you want services attached to the contract so they continue to maintain, and then the hospital or the society at large actually gets the real benefit of the transition to clean energy. And that's politics, law, and finance combined, right? Cande, we'll get you in a minute. You can catch your breath. And we'll have Joan finish off this little section here, because I'm really interested in the scaling. You know, there may be people here who can think of other places where your project, your HETA can go, but we've got to get to scale, right?
Absolutely. While it's easy, and I totally agree with everything you've said, while it's easy to be able to deploy solutions for the private sector, of course, because some big institutions have got net zero goals, and they've got really clear strategies on how to be able to displace the diesel generators within the health facility. For the public health facilities, which is really a majority of most countries in Sub-Saharan Africa, that remains to be, a great challenge. And clearly, of course, when you visit some of these health facilities, of course, they show you that panel belongs to, whatever donor, and they point, right? And you find it's really a skeleton of panels that are not working. So we need to move to a place where we are charging for electricity delivered and not necessarily, the equipment that's installed. And I would say that 3 successful, keys to making sure that you structure a bankable energy as a service business model. The very first one is having a viability gap fund that then supports, these public health facilities to make sure that the tariff is one that is, number one, affordable, easy for them to pay. Number 2, a grant mechanism that buys down the cost at the very beginning to make sure that, the end tariff is actually something that is affordable. Because if the grant financing is not to a point that is sustainable, then you find, of course, that full capital expenditure is transferred through the tariff to the health facility. The third one is, the payment guarantees needed for public sector. Obviously, any private sector participant in this market would be very worried about, receiving their money at the end of the month from a public institution due to the payment risk that's involved there. So being able to structure maybe a liquidity mechanism or a long-term guarantee mechanism, if you're doing it within a larger context, right? So the likes of MEGA, so that then you're able to actually keep, government obligation. Actually, government is actually able to honor their obligation. So I'd say that in terms of, what it takes to structure a successful energy as a service. And we're trying to actually scale up interventions in different markets. Right now, we are looking at 4 markets. We're looking at Madagascar, Mozambique, Zambia, and forgotten the 4th one, Malawi, sorry, those 4. So we're trying to scale up an intervention in those 4 markets where we will have the ministries of either energy or health as a contracting authority and trying to see how do we electrify hundreds, of health facilities.
Yeah. Fantastic. Well, Kande, welcome. We put everybody's fantastic titles and things on the screen. There you go. Nice. Well done. You and I have known each other a very long time. I know you're perfectly well placed now to just talk up, partly from your SE for All experience, but also now in your role in Sierra Leone, really leading the charge in the sustainable energy transformation of the country. Obviously, we'd like perhaps to talk specifically about steps in Sierra Leone, but I think if you could help us just frame this right for the context that you are in, but also to think about the diversity of situation across Africa, right? So we've really got to be sharp about what sort of strategies work in what place to get capital to flow of all types, public and private, towards this critical nexus of health and climate. But anyway, Kande, I know you'll know what to say, so off you go.
Thank you very much. It's great to be here. Sorry I'm late. I was in another session, so I had to run off. Again, dealing with nexus of energy and health. But I'm very pleased to see Laura here. Wow, long time. But it brings back memories. 2012, we were together in Rio +20, trying to make a case for a sustainable development goal on energy. And it was her presentations on energy and health that really made things happen faster, together with Maggie Chan, at that time Director General of WHO.
Yeah.
So we've come a long way to do this. Look, let me give you, everything you've said applies to us in Sierra Leone, so I give you a context there, and maybe I see how I zoom out. 26 to 30% electrification at best. Access to electricity is what we have. Our president now has set clear targets We want to do 300 megawatts more of bulk power. We want to do 200 more mini-grids. We want to electrify 1,000 clinics. World Bank is going to do 200 for us. Sustainable Energy for All is going to do 30. So we're a long way off on that. So our numbers we know. The last event I was at was facilitated by the Minister of Health. And then in Sierra Leone, we already have 100 mini-grids. So we want to go from 100 mini-grids to 300 in the next 5 years. We want to go from 250 megawatts installed capacity for 8 million people. We want to add another 300 megawatts. Yeah, and if we add the 300 megawatts with solar and hydro, we already go 60% renewables in our energy mix, straight off. Yeah? So our numbers we know. So the challenge then is how do we create that ecosystem to get private sector in? You were looking for a fourth country. I'm giving you a fifth. Sierra Leone. Thank you. My other friend is here.
Yeah, no, that's good. It's all good.
All the old Mohegans are all here. We were doing this. So we made the case for a sustainable development goal on energy. And the argument was clear. And we had to get the health people, the children, those dealing with children's issue to help us support the argument. Why you needed energy. Energy is the ultimate enabler of economic growth, food security, clean water, sanitation. We used to fight with others. Why energy? We said, well, if you don't have energy, you can't pump the water. If you don't have energy, you can't treat the sewage. And the hospitals don't run. So Laura's pictures of people doing surgery and the power going out, and they have to use a torch to finish stitching up, helped to make that case back in 2012, before 2015, when we were making the case. So in our context in Sierra Leone, we know our targets are clear. Part of my job and the Minister of Energy, Minister of Environment, is now to drive that from the top. You need political will. Energy issues everywhere are sensitive. I give you my own crisis now. 100 mini-grids, concept proven, largest concentration for 5 countries in that sub-region. They're in trouble, they're in distress. Exchange rate devaluation has occurred, high inflation bringing in their inputs. Now they're suffering, but our tariff is already at 85 cents a kilowatt hour in the rural areas. Wow. They're asking us now, last week before I left, we want to increase tariffs. Well, if we allow full pass-through with the devaluation and inflation, then it will be $1.10 in those rural areas. How do we deal with that? How do we manage forex risk, but also now the higher cost of operating? We're discussing now subsidies. The initial 100 mini-grids, we did CAPEX subsidies straight off. Thanks to FCDO, UK support, and UNOPS, we did that. But they're struggling now. But we need to grow that market because we want to do another 200. So how do we do that? Financing is a big issue for us. Also, we're going to put legislations in place. We already have a renewable energy policy. We want to see how we even make it better to encourage you and others to come in. Electrifying health services is clear to us, but one of the discussions we're having now, the first set of mini-grids, 36, 38 kilowatts, was mainly to power health centers.
Right.
Yeah, but they're not sustainable. So how do you connect it to productive uses so you have an integrated solution for the community? Maybe it's 300 kilowatts you need in that community so they can power the rice mill, maybe a cold room for their fishing, so they have income to pay for those services and can pay for the rest of the mini-grid. But maybe you can supply clean water. So now for our second generation of mini-grids, it's not only to create 200 more, it's to add a little bit more power. 300 kilowatts, so that they can advance productive uses, maybe supply irrigation water. So we need some integrated solutions, which creates a little bit more demand for the mini-grid operator. So these are the challenges we face right now. But again, I think governments, we have to make some hard choices. And maybe by now we all realize after COVID that deep nexus between power and health. That in fact, therefore, it makes sense to talk about subsidies. That our governments must say, we will forgo something else to have our own $10, $20 million to put in energy systems where they impact social services. I'll give you one anecdote. 17 years ago, I was in Morocco on mission. And the Minister of Energy was very clear to me then I was in the UN. He said, we made a choice as Morocco that we know we will not reach the mountain areas soon, in the next decade. Right. So we have decided as a government that we'll put solar panels in those communities and we will subsidize them. Yeah. We're doing that subsidy because it's about social inclusion. It's not for something else. We need those populations already in the 21st century, so we will subsidize the panels and other services that they need to use the power. Those were mainly carpet producers and goat milk producers. So at some point as governments, this is not my president's opinion, this is my opinion. So the handlers will go back and say, he's committing you. I'm saying yes, that at some point, 10 million, we should put something on the table to encourage mini-grid developers to come in to help de-risk while we leverage from others. The last comment is what you said, coordination. Many people want to help us, but nobody wants to be coordinated. They even choose their locations. But then people tell you the country should be in the driver's seat. I have 5 million, but I'm going to put it here, and this is how I'm going to do it. We're just discussing that. Well, I spent 20 years in the development space, and we were telling countries you have to be in the driver's seat, which means we need a plan. And yes, when the EU comes, the EU has to look at our plan. It is our plan. Part of the climate summit in Nairobi was about that. We Africans want to put our own narrative, our narrative of positive climate growth, which means listen to us once in a while. Don't tell us what you think we should be like. The ambitions are big. We want to go into green industrialization. Renewables can help us do that, but we need scale. We need scale. Yes, we're talking off-grid, but we need bulk power as well. For economic development, for transformation. Green minerals, we want to add value. That's what our program was about yesterday with President Ruto and our other presidents. 40% of the minerals that are needed now for the global green transition are with us.
Are in your countries.
They're with us. But we don't want to do 17th century. We don't just want to sell raw nickel, you know, lithium. Everybody's there signing deals for lithium. We want to add some value, so we create wealth, and we can then subsidize you to come in. So the thinking has to be different as well, and people must be willing to let us be in the driver's seat, to listen to the ambition of our children. Our generation may have been receivers. Our children are well educated. They want to be in the driver's seat.
Quite right. Well done.
Can I run away now?
Candy, if you have to, you're most welcome. But, you know, we'd like to keep you. Dan, bless you. Thank you very much for coming, chasing across the campus, as it were. Your title is on the screen, and there's paper to tell you what amazing things Dan has done for many, many years. But we'd really like to talk to you and have you talk to us.
Well, my thanks, James. Thanks for doing this. And we go back all the way to Accords before some of you were born. But Joan, thanks, and Candy, that was brilliant. Following Candy, as you know, is difficult. But I would just want to start off by saying I endorse what he said. I'm listed here at the University of California, but I spent last year at USAID as the Senior Advisor for Energy and Innovation, essentially working to set up the HEDA program, Health, Electrification, Telecommunications Alliance, and before that, Science Envoy under President Obama. And everything that you heard here, I think, are really the key lessons that HEDA was designed around. So even though I suspect you talked about it, a couple of the design features are really designed to leverage exactly what you said. First, HEDA is not a government initiative. It's a government-launched initiative, but it's technically a GDA, which in US government parlance means it's a global development alliance. That means private sector, civil society, business, and governments co-create it. And so what I'm going to get at the end, so-called HEDA Plus, is precisely one of those evolutionary steps. And so the degree to which Candy said that African governments, African research laboratories, and there are some wonderful talks going on these 2 weeks about alliances of African researchers, African NGOs, public-private partnerships, being in the lead in designing what projects will go in not only to power Africa, but to export those value-added commodities. One hopefully useful digression is that a coal-fired power plant that was scheduled to be built in Lamu on the Kenyan coast, ironically within literally stone's throw of a UNESCO World Heritage Site, was defeated through a combination of the kind of grid modeling that my lab led on with partners at Strathmore University, University of Nairobi, and civil society, Save Lamu, Decolonize, a number of groups. What that project left behind was no coal plant, but it also left behind a pad that had been designed for the plant to go into. That is precisely where we're working with the Kenyan government, European Climate Foundation, and many others, to put first solar and battery assembly, but then manufacturing with sustainably harvested materials. And I just ran literally across from the blue zone, so apologies for no jacket, because I was at a no deep seabed mining discussion. So it's a bit of a long digression, but it highlights the African lead, but African is a global lead. And Africa will be the second most populous continent by the end of the century. And so it's critical to be thinking not only in terms of how HEDA can work, how the health clinics can work with clean energy, but how that scales. And so everything in the HEDA Alliance is designed to, as you heard, build and then overbuild the clean energy, reliable power so that community energy, the hubs of not only power mini grids, but also telecommunication, water purification. And I don't know if we have representatives here from PowerGen or Zola or Off-Grid Box or any of the mini grid providers that are leaders in doing this with indigenized African technology are here. If you are, stand up and take a bow. If not, I'm going to sing your praises anyway. But the goal is to build that out at great scale. So HEDA is designed to recognize through data analysis, through field visits like Jordan and I had done in South Sudan and elsewhere, that of the 170 or so thousand health clinics, from the smallest rural dispensaries to the biggest tertiary hospitals, 100,000 of the 170,000 health clinics in Africa either don't have power at all, don't have reliable power, or don't have power they can afford. And so even if we had all the money in hand for the CapEx, for all of the clinics, which we do not, although it's not bad.
We could.
Through GAP and through efforts, there is about half, there's roughly 3 billion or so aggregated. Doesn't mean it's being put through African leaders making the decisions, but that is a non-trivial start in 2 years. But even if you had all that capital, those of us who've been in the development space a long time, and Candy highlighted it, know that it's often the case that funders, governments, private sector partners are in love with the capital, but not in love with the O&M, not in love with community building, not in love with training. And so frequently when I go to rural health clinics in South Sudan, in Kenya, in the DRC, in Rwanda, all of which are places my laboratory works, we find that with a bit of hardware and a bit of training, the first things that happened is the doctor or the physician's assistant or the nurse finds a job in a big urban area or finds their way to Europe or the US. So unless you invest in capacity building, and we think that's about 50% of the cost. So if a rural health clinic is going to cost $20,000 for the microhydro, for the charge controllers, we think you're going to have to think double of that. And that means this revenue stream that Candy talked about and the justice aspect that Joan works on is so critical. Because if you don't do those, you run the risk of creating what I will call, with all racial comments intended, a white elephant. Funding upfront, not back-end programs. So all of the comments about how HEDA can work, how these private sector leads can be critical are there. But I want to add another piece, and that is in a partnership which we're now calling HEDA Plus. There's a partnership, and Joan and I have sat down on the sidelines of the African Climate Summit and elsewhere. So one of the first things we found when visiting health clinics in the Kivus, in Eastern DRC where I work, and in Kenya, was they said, we love the idea of these electrified, reliable power clinics. We absolutely want that to happen. But if you don't center gender, racial, tribal, environmental justice, what you run the risk of is a great intended plan benefiting the more affluent members of the community that will access, I hate to use the term, but Western medicine, technological-based medicine, and not reaching the poorest members of our community. Find a way, we implore you, they said, to center ethnomedicine, community medicinal practices, both on the preventative side and on the curative side in this process. And in fact, you don't have to look far outside of health clinics all across Sub-Saharan Africa, often right outside the door, sometimes next, just adjacent, where traditional groups are selling ethnomedical solutions for headache, for COVID, for menstrual issues, for a whole variety of issues. Center those, don't sideline them when you bring in hardware. So in Laikipia County, Kenya, a very large, geographically long county, we are launching HETA Plus, a partnership between University of California, Berkeley, Power Africa USAID, and UNDP. And the goal there is to build exactly the health clinics we heard here with maintenance and long-term sustainable business models built in, but then to bring those ethnomedical producers into the clinics to offer certificates and training so that culturally appropriate local medicine is centered in the process. And this effort in Laikipia, we plan for now 2 years with this pilot sector funding to launch 7 to 10 clinics, some very small, very rural, with different tribes for the Kenyans in the room to work Majimboism in our favor, not against us, to work in different communities, and to have those feed into the tertiary clinics where, again, ethnomedicine is centered as well. So technologically based medicine and traditional medicine going hand in hand, because our goal here is not to highlight solar but not health. Our goal here is to improve all of the SDGs. And one of the options here is to pull those together.
And look, one parting shot, because we're going to go to Yasmin in a minute, is that in both cases, communication is vital.
And that's the T in the
header.
It's
the T. Yes, so just want to quickly emphasize that because it's really important and it allows a genuine leapfrog because the digital age has arrived and you've got highly technologically savvy customers who are entering the real economy perhaps for the first time via a digital address on a phone. And this is the T is important, right?
Yeah. So maybe one quick thing on that is that Jordan and I and others in the room have been not only placing very low-cost sensors, so we know power outages, we know interruptions, we know when frequency and voltage goes up and down, by having that data come out directly. I think that Jordan may be the largest deployer of a particular sensor built at Berkeley. We're using them in all these clinics as well from a small company called Enline. And the benefit is that because this is a GDA, the companies involved have agreed not to be paid up front. They have agreed to be paid based on delivered, not just kilowatt hours, because kilowatt hours alone don't provide health.
Service.
Delivered services, verification, and of course every patient can know my medical records, when do I have time to see the physician's assistant, if I have to walk 2 days to the health clinic in Bor in South Sudan or to Dol Dol in Laikipia. And so leveraging IT is a critical part. So thanks for raising that.
It's key. Do you want to have a parting shot? Because we've got to get Yasmin up.
What is fascinating about the digital connectivity piece is that there's a huge opportunity when you look at all the tower networks, right, across Sub-Saharan Africa. There's a huge opportunity to collocate pipeline for tower companies next to the health facility, and in such a way, solarize both and have the same level of service level between those two. I think that is really a low-lying fruit that most of us have not necessarily looked at. And at HETA, we are trying to, be able to co-create those kind of opportunities with tower companies and mobile network operators. The other key thing is, of course, just working with mobile network operators to make sure that each facility is digitally connected. Most facilities do not have a way of, proper record management. And of course, with a digital component, then you're able to facilitate that and facilitate innovations such as telemedicine, and other health innovations that then rely on a reliable connection.
Okay, we're tight for time, but we thought it would be good to end by connecting solar and education. So, Yasmin, I want to go straight into whatever. Go.
Thank you very much. It's been very interesting to listen to all of you. And thank you very much to the Crown agents for inviting Education Cannot Wait. We are a global fund for education in emergencies and protracted crisis. We are part of the UN system. We work with UN agencies, the host governments, and civil society in countries where all that we have discussed is probably the most in demand. These are countries of armed conflicts and massive climate-induced disasters. Just imagine, rather than being here in Dubai today, you or your children sitting somewhere in Sub-Saharan Africa or in the Middle East or in the Rohingya camps in Bangladesh, or a girl in Afghanistan who has neither access to solar system nor access to health, let alone an education.
We'll go a bit later.
There are, according to late or recent studies by Education Cannot Wait, which is a global fund, 62 million children today, right here, and right now, do not have access to any form of energy, green climate change, adaptation, mitigation, let alone health or protection, security, you name all of it. So what we do is that through education, we reach out with solar energy, with health, with climate-friendly interventions of adaptation and mitigation and building back better to serve the millions and the millions of children, their teachers and communities, because they are the ones left furthest behind. And if we are going to invest, our strong recommendation is, if we want to achieve sustainable development goals, is to invest in those who are left furthest behind from reaching them, right? We start with those furthest left behind. So we speak about the Sahel, Mali, Burkina Faso. We are in 44 crisis, climate-induced disasters and conflict countries. Burkina Faso, Somalia, the Horn of Africa, South Sudan, Sudan, Uganda, Central African Republic, Syria, Yemen, West Bank, Gaza, Lebanon, and the Rohingyas in Bangladesh, Ukraine, and also girls in Afghanistan. So thank you, James, for your question, and thank you to DPWorld and the Crown Agents for having us here. Now I have explained who we are, and we are a $1.5 billion fund, and we are only 6 years old. So we are one of those entrepreneurish funds in the UN that changes the way the UN works. Now, as I said, new public research that we have done shows that there are 62 million children who don't have access to anything of this, what we have discussed today. And we know that climate change is a driver for the forced displacement. So you have Somalia, there's drought, families are fleeing, and they will not go back. Even when the drought maybe changes and it becomes more agreeable, because they want their children to have an education. They want their children to have access to health. Education is actually the top priority. We think about 29,000 schools that were damaged or destroyed in Pakistan in flooding. We were there. We are very fast and rapid moving. So for us, the education crisis is a climate crisis. And as a result, it's also a health crisis. Because the schools, that's where the children get vaccinated. That's where they have a school doctor. That's where they have a school nurse. And that's where you can deploy solar energy and other innovation to ensure that they get health, they get energy, and they get the green energy, and they also get to be educated. So that's the linkage. And as I always say, and I think we all agree, you got to connect holistically many dots. You don't speak about climate change as a separate, siloed subject matter, nor do you speak about education as separate or health. It's all embedded. Like Leonardo da Vinci said, learn to connect the dots and see the whole picture. Now, solar energy have multiple benefits for education. It creates clean energy and create greater, safer, and greener learning environments for children. We can support children at school. We give them clean and safe water, which prevents waterborne diseases. And the solar panels, I mean, many of these crises and climate crises happen in countries where there's a lot of sun. So let's take that opportunity. So if we do this, and I will give examples before I conclude. In the Democratic Republic of Congo, we are using solar panel kits to provide electricity. There are now schools in the Democratic Republic of Congo, which has been in conflict for the past 60 years. They have solar-powered laptops, computers, and which are also used for school-based data and collection and storage. In Kenya, where we have a lot of refugees, we have provided access to clean and safe water, and also built schools that can withstand the shocks of climate change, and schools that also entail health. Now, I will end here. This is the very last I will say. Now, very seldom do you see the connection, climate change, education, and health, right? We don't see these connections very often. It's high time for the whole climate community to start looking at the consequences and the prevention as a result of climate change. We cannot have climate community there, education and health community there. That's silo separation doesn't work. And as a global fund, we pull all of you together. But we have launched today, here in Dubai, right here and right now, because it's happening as we speak, an appeal of $150 million to ensure climate change adaptability, mitigation, solar systems, education, and health. And for those who will receive an education and health through a climate-friendly approach, they are going to be the next, or they're going to be tomorrow's engineers, technicians, who can continue to prevent climate change from spreading and ensure that we build back better to also withstand the shocks of climate change. So if there's anything to invest in, it's right here and right now. Thank you.
Very good, very good. No. One of the most attractive features of our work in Sierra Leone in the hospitals was seeing the young engineers that did the installation who really loved having that often as their first job. I dropped one more thing in that I'm on the board of a company that won the Zayed Prize for Sustainability this year, Ignite Power. And one of the things that Ignite is doing with the Rwandan government is bringing solar to 50 schools and internet access via Starlink. Now there's a connection. I mean, I'd be very interested to see what happens over time. There probably should be a good, proper academic study to what happens for those 50 schools who go for it. Dan, I mean, you know, you're going to get a sample of 50 schools with currently no power at all, getting solar and internet access. Wouldn't that be interesting just to see what kind of development multiplier that would create? Okay, we've got to get some questions in. And we've got time because we'll take some questions and then we'll finish up with Dr. Mustafa, who will kind of close off as the Deputy Minister of Health from Sierra Leone. So let's go here, microphone coming, and then one over here after that. I'll stand up so I can see you properly.
So, hi, I'm Ranjit. I'm from UNICEF, and I manage the portfolio of primary healthcare infrastructure. We do work very closely, sir, with Crown Agents on healthcare waste management in about 10 countries, doing some good work. And also on solarization, I mean, we are coming in from immunization entry point. We have placed about 100,000 solar fridges in remotest part of the world. Yeah. And my pleas here is really, I mean, there's been some really good keywords came out. Ownership of the country. We can't get into somebody's house and say, we will maintain it for you. We can't do that until there's ownership from the government. There has to be a plan. There has to be a government plan. There has to be a Ministry of Health, Energy plan of solarization. And then the solutions need to be plugged into that plan. So coordination is really key to that stuff. We are raising about $1 billion for electrification, purely from the point of view of beneficiary of children. So we are looking at the, so beneficiary is another keyword. We need to look at that. Coordination, beneficiary, and impact, and so we need to be working closely on that. And we really don't. There was also very valid comment that you go to health facility, you see different donors banners and different donors, things. We should be avoiding that. It's really government. It's their program, and we are all plugging into their system. And I think coordination is key. So I'll really appreciate.
You won't get system change if you haven't got an idea what the system is.
Absolutely.
And we've all done this a while. We projectize to death a good idea.
Absolutely.
We've got to start thinking systemically, and then the intervention points to change the system. That's really it. Dan, you want to come in there? Because then there's a question coming in a minute.
And also just one last thing is that we're looking at also 10 years lifestyle minimum life cycle of the system.
Right.
So, and also attracting a lot of private investment. So we'll be happy to talk on that.
Good. Thank you.
Maybe just a brief one finger
Yes.
to sort of emphasize and agree wholeheartedly with that. In fact, one of the nice things about the GDA is that no two countries are likely to want to structure the country's commitment the same way. And so that's why this process of a GDA, where in Nigeria, for example, it's a partnership between the Ministry of Energy and Health to finance, to decide how to indigenize, to do the training. In Kenya, quite different. In the DRC, it's an effort more structured in the East around refugee communities, as you highlighted. And really, that's design flexibility is what we're hoping is actually the thing that spreads. That each country with its local actors creates the version that they think will be most effective. But the technology base, the training base, is utilized across all of them, because that's really the constant resource to bring to the table.
Sir.
Thank you very much, James. My name is Nasser Faqih. I'm part of Education Cannot Wait. I'm part of Yasmin's team. And a big part of our financing, what we mobilize, we're a fund. The largest amount of the resources we receive is usually from traditional donors. They have been the people and the partners traditionally spearheading, financing this social need, especially for education in crisis. And recently we've been looking for ways, how can we build new innovative ways of partnering with the private sector so that we can also generate new streams of finance to education. And it is fascinating to hear about the health and nexus with the climate that you've established, Christian, with impact investment. And my question is, to what extent can we do and start thinking about similar nexus with education, between climate and education? Thanks.
Christian, would you like to do that? That's an interesting one.
Yeah, absolutely. And actually, I wanted to react to what you said, because...
Is it myself?
Yeah, perfect. Thanks for the question. So what we're doing with healthcare could be like transported to the educational sector without any problem. This is actually the same issue. You have a government facility, you have a government risk, you have the solutions, because today you have the technology, it's there. And you have small modular systems. You can make that very cheaply today. So you need to find the same type of mechanism of bringing in the private sector and leveraging on the relationships built with the government and engagement, etc. So for me, and that's the long-term solution that we have in mind. We want to create something within the healthcare sector, because we don't want to try to solve everything at once. Get some proof points, and then use this model to do the same in the educational sector. And then you get to a scale where it becomes really interesting, both from private sector involvement, bringing in the companies, and being able to bundle project to a size where they become really interesting, where you get down with the pricing. Because that's your other issue, right? If you have 2 or 3 small clinics that you want to electrify, the cost of it is quite high. But if you come up with hundreds and thousands of clinics and schools that you want to electrify, suddenly the cost of doing that drops significantly. And on top of it, that's the moment when private investors get interested. Because they want to have scale. They want to be able to place a multi-million ticket. You need a 50 million plus fund at least to bring in the private sector. So you can't stay at the small scale. So for me, this is the beauty of it. That's where we want to go. Now, I'm a very practical person. And I really, for me, I agree with everything that was said. I totally agree with what else we need to look at and how complex these things are, right? But this is really a call for action. We need to start with something. We need to get data from the ground. We need to be able to show to investors, to the government, to everybody who's interested in helping developing that solution, what works and what doesn't. And that's why we have started actually piloting with Crown Agents, doing a project in Sierra Leone, because we want to get data from the private sector, from companies, what they can do, how many companies are out there who can do it, what is the price point, and then comes in the whole monitoring part. So we have everything will be real-time monitored, and you get all the data on usage, and then you can come in with what else do these health clinics need, right? Because energy is the enabler.
The data itself is going to have phenomenal value.
We need to start somewhere, and I'm all in for for working on all these different streams. But let's start. Stop only talking, start doing something. We can do it, we have the money, we have the technology, so let's get it done.
Yeah, good.
So we'll see you today after this.
Keith.
I guess I'm Keith and I work with Crown Agents. I guess for me, I'm the action person. Yeah. And after here, Yasmin and Nasa, I am going to be reaching out to you because if anyone can do it, we can.
Yeah, very
Absolutely.
good.
A very quick.
Very good. Are there any more questions, comments from the floor?
Just a comment.
Yeah.
On the conversation that has now taken place on the nexus of health, education.
Yeah.
And it's really amazing how there are certain things that have been done within the education space, right, that can be transferable to the health space. We are currently part of a consortium that's looking at mapping, and of course with UNICEF, that's mapping, health facilities, so that we get that, and same had been done for schools, and utilizing that information to be able to help, in terms of investment decisions, to be able to have a clear pipeline, because we are talking about scaling, right? If you don't have a clear mapping of where these health facilities are, what their loads are, how the situation is, then you cannot scale, right? Yeah. You cannot be able to apply an intervention that's looking at 100, 200 facilities. So you really need, that kind of intervention, and there are a lot of learnings that, we can transfer from both sectors.
Yeah. Are there any more questions? Because we are fortunate to have Dr. Mustafa here, so the floor is yours to use as you wish. I mean, we've put all the names up on the board before, so you're kind of pre-introduced, but you've got a chance now to kind of close off and really build on this connection between climate and health in your very significant experience in this area. So over to you, Dr. Mustafa.
Thank you very much. So I was supposedly giving a closing remarks, but since I wasn't really here to hear what all the other panelists have said, I think I'll just maybe speak about Sierra Leone.
Very good.
Okay, so climate change and health, right? And why is this important? Why are we talking about this from Sierra Leone's perspective? I'm sure many of you know we're on the coast, so we're a coastal country, and which makes us really prone to climate shocks. But also, as a nation, we've had several shocks and trials over the last 10 years, from Ebola to mudslides to flooding to drought. I mean, you name it, we've experienced it. And everybody keeps saying we're resilient people. I mean, there's only so much resilience you can take. Yeah. So I think it's high time we start mitigating some of these problems that lead to our trials, and addressing climate change related health issues is one way. As a ministry, we've decided we have 3 or 4 key priorities that we are going to focus on as we talk about climate change and health. And one of these, actually the first one, is building a climate resilient, I don't like that word anymore, but climate resilient health system. And for us, we see this as in 3 phases. For us to have a climate resilient health system, we're looking at having health facilities that have 1, renewable and sustainable source of energy, 2, sustainable source of water, and 3, the infrastructure itself that can stand up to whatever challenge climate change brings, right? So most of our health facilities were built decades ago. We're heavily reliant on fossil fuels for our supply, especially if you're talking about off-grid facilities. They run on diesel generators. Even the on-grid ones, most of the on-grid supply is from diesel generators. We're talking about the health facilities contributing to the problem of carbon emissions. And apart from that, this energy supply is also not sustainable. We have supply chain issues. It's expensive. I am a surgeon. I can't tell you how many times I've had to do surgery, interrupted electricity supply, and you finish the surgery on a mobile phone light. And lucky for me, it's eye surgery, so it's not a matter of life and death. But we see this in maternity, in childcare, across all other life and death situations. So that's one key thing that we need to stop. So for us, I mean, one other example, I don't know if it's been mentioned here, because we also have many other experts here from Sierra Leone. I would say the Crown Agents team are probably more of an expert on energy, energy and health in Sierra Leone than I am at the moment. But we have a very recent story of power outage in one of our pediatric hospitals where we lost 6 babies in one night because they were dependent on oxygen supply. So, I mean, is a tragedy. It's unacceptable. We cannot be having such stories anymore, not in this day and age. We're also looking at digitizing our health system. That's not possible if you don't have energy. How do you do that? And more importantly, also, we're looking at launching, in about 1 week, we're launching our National Public Health Agency. Why is this important? This agency would be the house of our One Health approach. So it's going to be coordinating all emergency responses, whether it's climate change or disease surveillance. Now we're talking about new emerging diseases in Sierra Leone related to climate change. More malaria, dengue, typhoid, cholera. There are many problems, and most of them could be related to climate change. So this agency is going to be launched. For this agency to work, for it to be efficient, we need digital health systems. And for that, our health facilities need to be on energy. They need to have sustainable, reliable energy supply. Solar electrification is probably the way to go. We've had examples of health facilities in other countries that have done this. It works. They've shown it works. We've started doing it in Sierra Leone thanks to our partners, including Crown Agents and FCDO. We have a goal. Right now, we have 1,600 health facilities in Sierra Leone. We have resources committed or pledged for at least 200, 250. But we want to have all those health facilities on sustainable energy and water sources by 2025. And we're even going further. By 2030, we want to expand this to 2,000 facilities because we want to make sure the facilities are in the communities where they need them. When we have climate crisis, sometimes communities get cut off. They can't access the nearest health centers because they're too far away. So we're looking at expanding up to 2,000 by 2030. And all of these 2,000 should have energy sources, water sources that's resilient, that's renewable, that's sustainable. I mean, we don't want any situation where we have interrupted healthcare provision for any reason, no matter the challenge, whether it's climate or, in our case, sometimes human-induced, whatever the situation is. We want our health system to be there, to be working, to be safeguarding the health of our population. So I just want to end by saying We have our goals as a ministry. We're very lucky to have partners who are working with us. These goals are already costed, I should say. We have price tags on these goals, but apart from financial resources, we're also looking for technical expertise and, basically any way you can help us to achieve our goal. We're open to engagement, discussions, and we welcome all of you. And we're not going to wait for you to approach us. We're going to be knocking on your doors all the time. Remember this face, okay? You're going to get fed up with it. So thank you very much. Thank you, Crown Agents, for organizing this session and for asking me to participate in it. I am very happy to do that on behalf of Sierra Leone and my Minister of Health, who cannot be here, but I'm happy to represent him. Thank you.
Well, look, I think we should bring this to a conclusion. We've got a little bit of time, which I think we could use, frankly, for having the conversations that you would like. There are some people on the panel here who can help. But I think we should just thank everybody for coming, thank the panel very much for all that you've contributed to our discussion. And yes, maybe you've got a couple of minutes where you can mingle, and you'll have to clear the room at some stage, won't you, for the next lot. But anyway, thank you for coming, and good luck.